They are the heroes on the front lines of the fight against COVID-19 in our city, leaving their families behind to take care of ours. Today, we're shining a spotlight on them and their lives. In our Frontline Diary segment today, we connect with Victoria Hudson, a registered nurse in the Neonatal Intensive Care Unit at the Ottawa Hospital. Victoria, good morning. Thank you for joining us.
Morning.
How have things changed in the NICU since the pandemic started?
Well, we all wear masks. The visiting hours have changed. Parents can only come in one at a time right now to visit their babies, and they have to take turns. So there's a little bit of change with the bonding that happens at the bedside. So that's a little bit different, and also the way that we at the NICU resuscitation and deliveries that's changed a little bit as well. We have to be very careful about what kind of deliveries we go into prior to the baby being born.
Yeah, I mean, in normal times, it's difficult, I would imagine, for families to have a little one in the NICU. But during a pandemic with extreme measures, I can't even imagine how hard that must be for those families. And you're there to help them all along.
Yes. It can be very difficult for the families for sure. And we, as the NICU team, are sort of in the business of helping to build family bonds. So it can be very challenging for us knowing that parents are wanting to have this time together, and it's very difficult for them to all be together at the same time right now.
As an essential worker, you're also a mom, and I understand your husband's an essential worker. Talk to me a little bit about how your life has changed and been impacted by working in the hospital during the pandemic.
Well, right now my kids, I have a 5-year-old and a 3-year-old. They are back at daycare right now, which is great for me because during the pandemic, my husband also is a frontline worker, and we didn't take anybody's offers to care for the kids because we wanted to keep them at home and we didn't want to expose anybody else. So I was working pretty much all nights and weekends, and on the nights that I was working, I would parent the kids during the day. My husband would come home at night. I would go in and work my night shift, and then I would come home and parent them again all day long.
So where did you sleep? I didn't hear anything about sleeping in there.
I didn't really do a whole lot of sleeping for about 3 months.
Wow.
I would try to catch a nap every now and then when my husband would come home. And on my days off, obviously, I would go to bed quite early. But in the meantime, there wasn't a whole lot of sleep for about 3 months.
Wow. What's the hardest thing you've had to face in your job during this pandemic?
I think the hardest thing for me at work, especially, is really just seeing parents have to make very difficult choices and not have the support of each other. So if a mother was suspected of being COVID positive, she would have to make a very difficult decision whether she wanted to send the baby to our unit so that we could take care of the baby until she had her swabs back, or she would keep the baby in her room with her in an isolette, but they were very distanced from each other. And at the start, we didn't know a whole lot about how things were transmitted, so it was very scary to try and protect ourselves and protect the families that we were going home to.
Do we see little babies with COVID? Is that possible?
We haven't seen any here at the Ottawa Hospital, although if they are exposed to a mother who is potentially positive with COVID, we put them in an isolation room. We have a couple of isolation rooms. I'm actually in one of our isolation rooms right now, and we keep them apart until both of their swabs would come back negative. So okay. We haven't actually seen any positive, but there's always the potential that somebody could be positive.
What have you learned as an RN and as a mom in all of this? What's the takeaway for you?
I guess I've learned that we all just need to be patient with each other. It's a really scary time. less so now. I think the community's done a really good job of keeping things under control. But I think we all just need to be really patient with each other during this time. Some people are more fearful than others. Some people don't take the same precautions as others do. And we all just need to be really kind to each other to work together and get through this. And I think as a community, we're doing a really good job of that.
Well, and that's because we have people like you, Victoria, who are at the helm of it and making sure we're all safe, doing the work so that we're all safe, leaving your family behind for ours. Victoria Hudson, thank you so much, an RN in the NICU at the Ottawa Hospital. We appreciate you and all of your and everything you're doing for us.
Thank you so much.